Hello friends, today we'll be discussing about high grades of baldness. This is a unique topic because a lot of patients who have grade 5, grade 6 or 7 baldness, they pose a different kind of challenge to a hair transplant surgeon. The challenge is of the numbers. So they require a huge number of grafts which they might not be having in the back of their head. So in such cases, we have to plan out the things pretty well in advance so that we can maximize their donor to get head full of hair. Now, what's the plan, what's the strategy when we deal with such cases? First and foremost is realistic expectations. So these patients should have realistic expectations. The transplant result can only be as good as their donor area. If the donor area has less density or the donor hair are thin, don't expect the entire scalp to get filled. Second and very important is the correct selection of method. Now, interestingly, a lot of patients who come to me after having consultations with different clinics, they tell that doctor told me that we'll do FUE surgery only because it's the best, and some places the doctors told them we'll do only FUT because it is the best. It is not about FUT, it is not about FUE, it is about the patient, it's about you. In case we do only FUE extraction, which is done at most of the places these days worldwide, you can never get the desired number of grafts from safe donor zone. Yes, each and every word is important here. You can see there is a video on number of grafts on my YouTube channel. These are important ones. You must understand these differences before you decide upon the method. The number of grafts which we can get by safe donor zone in FUE in an average Asian patient is less than 2000. While in FUT this number is somewhere around 3000, 3500. So combination of the procedure FUT and FUE really helps. Usually in a patient with high grade of baldness, I adopt a technique called maximum harvest technique or MHT. Now this is an interesting combination of FUE and FUE in the best possible way so as to maximize the donor utilization. I'll show you this with the help of an example. Now if you see this patient had a broad, very broad forehead and a huge crown to fill, and most of the clinics told him that the surgery is not possible in one session, we'll be doing only the front, and many clinics told that crown it is impossible to fill. Now this patient, when came to me, I examined his donor area. It was excellent. It was really very thick and dense. The elasticity of skin was also very good. Now, coming back to the first point which I made was realistic expectations and realistic promises. So when I examined this patient, the donor was good and we decided to go for a combination of FUT and FUE. The first, we did 3000 FUT, 2000 FUE from scalp and 1000 beard. We could have done more beard grafts, or maybe we could have combined some body hair as well in the first go itself, but there was some budget constraint as well. So we did this session and we had decided to go for the filling or touch-up work maybe after around 6-7 months. So if you see the results, this is after the first session. Look at the front area, it looks quite good, though it needs little touch up in terms of density. Then if you look at the crown, it was a huge crown, but now it's quite filled, but he needs a little touch up here as well. Second FUE surgery from the same donor area is risky in terms of graft wastage. So we did another FUT surgery for him, which gave us 2800 grafts. After 5 months, the front area looks quite good, the crown is full and it's going to improve further. If you look at the scar of his first surgery, FUT surgery, it was barely visible. I didn't even bother to include it in the next surgery. The second FUT surgery scar also is hardly visible. Now the advantage with repetition of FUT is that you don't compromise the density and graft acceptance is really very well. So that's the way to go about in a person of high grade of baldness. In case if the donor area doesn't allow you that many grafts, then we have to focus on maybe the front or maybe the crown, whatever patient wants. Usually we prefer doing it in the front. So if you look at this patient, this patient is 61, 62 years of age. He had from front to crown, he had baldness, it was grade 6, and we had limited number of grafts because of budget constraint. So we did just 1700 grafts by FUT, and if you look at the result from the front side, it looks very full. The back is empty, the crown is empty, but even this looks good. So all I want to convey is, if you are having a high grade of baldness, please consider all the options. No technique is untouchable. Don't think that I'm not going to do this or that. At least give yourself a chance to know what's good for you. I hope this video will be useful, and if you want more such information, please subscribe to our YouTube channel, and you can also follow me on Facebook and Twitter. Thank you. Love yourself. Stay blessed.